Thank you very much for the kind introductions. So today, we are honored to be invited to present a study that we undertook on uptake of pre-exposure prophylaxis amongst adolescent girls and young women who are enrolled into the DREAMS program in Zimbabwe. The DREAMS program is a USAID PEPFAR supported program. This is an HIV program that is an HIV prevention program that is targeted at reducing new HIV infections amongst adolescent girls and young women. The DREAMS program, which is an evidence-based program, is responding directly to evidence on increasing HIV infection amongst adolescent girls and young women. If we look at data in Southern Africa or in Africa in general, and in Zimbabwe in particular, there is evidence of age and gender disparity in HIV infection, with adolescent girls and young women disproportionately affected by HIV relative to their male counterparts. And GBV is at the center of driving HIV infection amongst the adolescent girls and young women, with 1 in 3 women having experienced GBV in their lives. So pre-exposure prophylaxis, PrEP, provides protection to anyone who is at high risk of contracting HIV from contracting HIV. And therefore, because the DREAMS program is an HIV prevention program, this PrEP presents a window of opportunity for us to support adolescent girls and young women from acquiring HIV infection. The DREAMS program provides a comprehensive evidence-based core package of services that go beyond the biomedical to address the social, cultural, and structural barriers to HIV infection. The DREAMS program core package of services provides services from provision of adolescent-friendly sexual reproductive health and biomedical interventions for male partners of adolescent girls and young women, to addressing social protection issues for the vulnerable adolescent girls and young women, as well as engaging the parents, guardians, and communities where the girls are coming from in order to address the community and social and gender norms that put adolescent girls and young women at risk of HIV infection. And this evidence-based core package is provided in a layered approach, which entails that we intervene, we reach each and every one of our clients with a multiplicity of services to address the multifaceted challenges that they face in their lives. So in this study, we aimed to assess PrEP uptake amongst adolescent girls and young women. And in terms of our objectives, we wanted to determine the knowledge level on PrEP, as well as to establish what the uptake was amongst our target group, and also to understand what the barriers to uptake of services was. This was a cross-sectional study, and participants were selected from 4 priority high HIV burden districts in Zimbabwe. We applied a mixed method approach, and primary data was collected through in-depth interviews. We also used the structured questionnaires to complement data collection. We analyzed the data through SPSS version 2.2. In terms of results, what we established is that 56.8% of the adolescent girls and young women who participated they were very knowledgeable about PrEP and the way they could obtain PrEP services in their areas. A small proportion of about 6% had accessed the PrEP within the last 6 months, and 68% of our participants were single, with 17% married, and 13% were divorced. 55% of these girls and young women were very satisfied with using PrEP. But amongst the barriers to uptake of PrEP was the issue of seeking consent or seeking approval or permission from their sexual partners or another third party. Girls could not make a decision whether to enroll on PrEP without consulting these significant others. And 43% of the adolescents did not have adequate knowledge of PrEP. 24% were not decided whether they should be enrolling on PrEP or not. In terms of the conclusions, because PrEP is one of the evidence-based strategies that we have for HIV prevention, we are recommending that PrEP be scaled up to all districts so that adolescent girls and young women can easily access it and prevent HIV in their lives. Thank you.